names here, but I really want to vote against this. I think we should have kind of a strategy session with you and the ledge staff. Yeah. Because right now I think they probably have me as a yes, and I really would like to go to a no, but we need to understand the amendment completely as well. So, should we get on that, okay? And we're in session tomorrow with the Disclose Act. Call time for what?
Committee will come to order. Today's hearing, entitled Viral Hepatitis, the Secret Epidemic, will examine the concerns about hepatitis B and hepatitis C as raised by the Institute of Medicine in a recently released report. That report, entitled Hepatitis and Liver Cancer, a National Strategy for Prevention and Control of Hepatitis B and C, indicates that the United States is experiencing a hepatitis crisis. Many call hepatitis the silent epidemic because the attention is received has not been in proportion to the vast number of Americans it affects. Hepatitis B and C are among the leading causes of preventable deaths worldwide and are the most common blood-borne infections in the United States of America. The Institute of Medicine found that the current federal approach to battling these diseases these diseases is simply not working. The IOM report suggests a greater need for a federally coordinated response to these diseases, better surveillance, knowledge and awareness, immunization, and viral hepatitis services. Today's hearing will review that report and will explore how to implement its recommendations. Today, I would like to welcome my colleagues who are helping to focus much needed attention on these diseases. Congressman Hank Johnson from the state of Georgia, and of course Congressman Bill Cassidy from the state of Louisiana, and of course Congressman Mike Honda from the state of California. I'd like to thank all of you for being here today, and we're also joined today by Howard Koh, Assistant Secretary for Health at the Department of Health and Human Services. He is accompanied by Dr. John Ward, Director of the Viral Hepatitis Program at the Center for Disease Control. I thank all of our witnesses for being here today and look forward to hearing about progress on this issue, as well as how Congress can play a more pivotal role in making sure evidence-based recommendations are implemented. I want to thank all of you for being here. At this time, I yield to Congressman Chaffee from the great state of Utah for his opening statement.
Thank you, Mr. Chairman, and thank you for calling this hearing. This is an important, vital issue. I'm proud that this committee would actually bring this to our attention and to hold this hearing. I want to thank the members, bipartisan group of members who are concerned about this issue. I'd like to associate myself with the comments that you made. This is a huge issue. It affects Americans from coast to coast. It affects the world, really, and it's something that we need to pay a lot more attention to. I would like to ask unanimous consent to enter into the record the comments from Ranking Member Darrell Issa, as he had some comments on this.
Without objection, so ordered.
And I would much rather hear from the panel than hear from me. So with that, I'll yield back the balance of our time.
Thank you very much. Thank you, gentlemen, gentlewoman from California.
Thank you so much, Mr. Chairman, and for this exceedingly important subject matter hearing on the secret epidemic of viral hepatitis affecting millions of Americans and their families each year. This hearing comes at a critical time. 1 in 12 people around the world are afflicted by chronic and viral hepatitis, and it is one of the most leading causes of preventable death worldwide. In the United States, about 1,500 people die each year from liver cancer or liver disease as a result of a hepatitis infection. But if we increase the amount of resources and awareness devoted to this disease, many of those lives could be saved. Treatment does exist, and it is more effective if the disease is caught early, but because this disease is asymptomatic, as many as 75% of those infected do not know it until they have already developed liver cancer or liver disease. In response to this serious public health problem, the Institute of Medicine was asked to provide insight into what opportunities were being missed in relation to prevention and control of hepatitis B and hepatitis C. And the IOM's committee found that there is a staggering lack of knowledge about chronic viral hepatitis among healthcare and social service providers, as at-risk populations, members of the public, and policymakers. And without proper knowledge, healthcare providers cannot sufficiently screen and treat their patients, and Americans who may have the virus will not understand the dire need to get tested. As a representative of California's 33rd district in the city of Los Angeles, I understand the impact these viruses have on individuals and society, and also the disproportionate effect they have on certain minority communities. Chronic hepatitis B is a leading cause of death in the Asian and Pacific Islander community. African Americans have the highest rate of acute hepatitis B infections. While hepatitis C affects both African Americans and Hispanics at the highest rate, while I am pleased that the Obama administration has taken the initiative to appoint Dr. Howard Cole as the Assistant Secretary of Health at the Department of Health and Human Services with the specific task of developing a national strategy for hepatitis, our communities and the federal government cannot delay in ensuring that they have sufficient culturally and linguistically sensitive access to prevention and treatment responses. So I'm looking forward, Mr. Chairman, to the day's witnesses and to learn more about how we can start impacting and controlling these vicious diseases. Thank you. I yield back.
I thank the gentlewoman from California for her statement. I now yield 5 minutes to Congressman Bill Bray of California.
Thank you, Mr. Chairman. Mr. Chairman, between 1985 and 95, I had the privilege of supervising a county of 3 million, specifically part of the supervisor's responsibilities in California is public health. And this was the period when the hepatitis epidemics seemed to spread very quickly, the awareness, whatever we can say on that. And with all the discussion that we had with HIV and AIDS and all that other argument, the dirty little secret was the huge impact on the general population, specifically the working class population of the hepatitis problem. And I just want to say clearly, as somebody who was able to be briefed in that period, I think one of the untold stories in this country is that a whole lot of a certain segment of our community, and it crossed racial lines. I think that what happens is so much easier to identify people based on the color of their skin, but not look at their social economic group. That group, which includes a very large percentage of the minority community, has been disproportionately impacted. But there is a generational issue here. So I think with these challenges, we need to recognize that there's opportunities. And I hope as we address this issue that we're not blinded by color because it's easier to do that. We look at the fact that there is a social economic group that truly is a rainbow coalition in the negative sense, but that it is also a generational challenge. With these two challenges, we have opportunities. We have opportunities to focus resources, focus attention, and go directly, like someone said, the laser beam, towards a much more cost-effective, a much more humane approach to this issue. I think the one thing that hasn't been talked about in the last year when we talk about health care is that hepatitis is the iceberg that is under the water that no one realizes that our healthcare system is running full steam for. There is going to be an impact here that we are totally ignoring and is going to have a major impact, not just to the private sector, but to the public sector and the community as large. And we ought to be addressing that. There are opportunities coming down the line, in my opinion, to be able to address this issue, address it with good science, good medicine, and hopefully good politics. This is something we don't see very often in this town. But hopefully we can work together. This is a bipartisan effort waiting to be done, and I hope we join together to do it, Mr. Chairman.
Thank you, gentleman from California, for a statement. Thank you very much. Any other members seeking recognition? Yes, the gentleman from Virginia.
Thank you, Chairman Townsend. Thank you for holding this very important public health hearing. It's valuable because it increases awareness of the dangers of hepatitis while addressing some common misperceptions and related stigmas about the strains of the virus. 5.3 million Americans are living with hepatitis B or C, and an estimated 75% of those are unaware of the fact they carry the virus. Public education is essential. Between 15 and 40% of individuals with hepatitis will develop liver cirrhosis if not treated properly, making hepatitis the leading cause of liver transplantation in the United States. Viral hepatitis causes 12,000 to 15,000 deaths annually, and approximately 20,000 people are newly infected each year with hepatitis C. Responding to this immense public health threat requires a comprehensive approach that reduces the unconscious transmission of hepatitis from mothers to children while reducing the transfer of hepatitis C through needles associated with drug use. Because hepatitis can go undetected for decades, many mothers have no idea they're passing the virus on to their children. Asian Americans are disproportionately affected by hepatitis B. Approximately 1 in 12 carry the virus. My district is home to a diverse Asian American population. In fact, it's the largest single ethnic group in my district. We need to ensure that our education efforts are multilingual and address not just illegal drug or sexual transmission of this virus, but also the unconscious transmission from mother to child, particularly for that more vulnerable population. I look forward to learning more from the CDC at this hearing about our efforts to arrest the spread of hepatitis B among especially Asian Americans. Since there's an effective vaccine for hepatitis B, we can make progress in reducing transmission rates. Some individuals with hepatitis C were infected over 30 years ago, prior to proper sterilization methods of needles in medical settings. Others received the disease through illicit drug use. Today, we need to focus on drug suppression efforts and effective needle exchange programs that can and will reduce the incidence of hepatitis C. It's clear that the primary obstacle to reducing the spread of hepatitis B and C is a lack of federal resources. In America's 5 largest cities, we provide only $90,000 annually for viral hepatitis prevention. $90,000. We need to do much more to prevent the spread of hepatitis, particularly because increasing the awareness of the disease and increasing the use of the vaccine could and would dramatically reduce rates of hepatitis B and save lives in America. And with that, I yield back.
Thank you very much. Thank you, gentlemen, for his statement. Any other members seeking recognition? Now we will move to our witnesses. We will now turn to our first panel of witnesses. Congressman Hank Johnson from Georgia has been a leading advocate in this Congress in pushing for more attention to be paid to the serious health risk that hepatitis poses to our nation. It has become a personal battle for Congressman Johnson, and I am thankful he's willing to share his story with us here today. Welcome, Mr. Johnson. We also have with us today Congressman Bill Cassidy from Louisiana. Mr. Cassidy has served his community for more than 20 years, helping to provide medical services for people in need. His efforts in his community included setting up school-based health programs to vaccinate children against the spread of hepatitis B. Welcome, welcome to the committee. We also recognize Congressman Mike Honda has also been very active in lending his voice to this issue by sponsoring legislation to help combat this critical health issue that affects so many Americans. H.R. 3974, the Viral Hepatitis and Liver Cancer Control and Prevention Act of 2009, if passed, will support the comprehensive prevention measure that are called for in the IOM report, as well as reduce the disease burden associated with the viral hepatitis. I thank you all for being here today, and I look forward, to working with you. It is committee policy that all witnesses are sworn in. So, Mr. Johnson and Mr. Cassidy and Mr. Hunt, if you would stand and raise your right hand. Do you solemnly swear to tell the truth and the whole truth and nothing but the truth? If so, answer in the affirmative. Thank you very much. That they all answered in the affirmative. Why don't we start with you, Mr. Johnson? And as you know the rules, in terms of the clock, we all that. But we're not even going to turn it on. We're gonna leave you with it because the rules. Okay, so. So we're going to come right down the line, Representative Johnson, then Representative Cassidy, and then Representative Hunter. Thank you, Mr. Representative Johnson.
Thank you, Chairman Towns and Ranking Member Issa for holding this hearing today. I applaud the committee for showing leadership on preventing and controlling hepatitis infections by holding this hearing on the federal government's response to the viral hepatitis epidemic in this country. As many of you may know, last year I announced that I was on a robust course of treatment for hepatitis C. Today, I'm back, I'm alive, I'm feeling great, and feeling strong, and in the words of James Brown, I feel good. I stand here today bolstered by the love and prayers that I have received from family, constituents, and colleagues. I hope that my disclosure last year will provide others suffering from hepatitis with confidence to speak out and educate the community about this illness. I'm testifying today because I know from firsthand experience just how devastating these hepatitis viruses can be on Americans. I'm one of the lucky ones who found out I was infected, had insurance, and was able to receive treatment. A few important facts that I want the committee to be aware of. First, 2/3 of Americans infected with hepatitis are unaware of their infection, leaving them unable to take action to protect their health and the health of others. Second, the only dedicated federal funding for hepatitis is $19.3 million per year for the CDC. This is not enough and pales in comparison to funding for other infectious diseases. Considering these two facts, it is clear that the federal government has failed in its response to hepatitis, and I'm hopeful that this hearing can bring about a period where this trend is reversed. Unlike the majority of people living with infection, I actually do know my status. The vast majority, with estimates as high as 75%, do not know that they are infected with hepatitis, the leading cause of liver cancer in America. A recent Institute of Medicine report on liver cancer and hepatitis found that health providers neither screen nor test for hepatitis, even for patients at risk. I'm grateful to have the support of my family and friends, my colleagues, and my staff. However, those who test positive often feel stigmatized, making it difficult to encourage people to know their status and get treatment. As with other infectious diseases, a proper and effective government response will lessen the stigma associated with the illness. It is important to note that even with the passage of health care reform, I'm concerned that hepatitis B and C will and can still impact those who have limited access to health care, such as injection drug users, the homeless, certain racial and ethnic minorities, legal immigrants living in poverty, and undocumented immigrants. As a member of the Congressional Black Caucus, I want the committee to know that rates of hepatitis C are twice the national average among African Americans. In fact, 1 in 10 African Americans between the ages of 40 and 60 are estimated to have hepatitis C. I want to say that once again. In fact, 1 in 10 African Americans between the ages of 40 and 60 are estimated to have hepatitis C. As we all know, African Americans are less likely to have access to adequate health care and would be positively impacted by an improved government response to viral hepatitis. Further, the baby boomer population is estimated to account for 2 out of every 3 cases of chronic hepatitis C. As these Americans continue to age, they are likely to develop complications from hepatitis C and cost Medicare billions in treatment, transplantation, and palliative costs. We can and should do something about this epidemic, and I can tell you, Representative Bill Bray, that the persons who I enumerated as being at risk are not as you say, as you pointed out, they are not limited to minorities. There are substantial numbers of Caucasians who are afflicted with this chronic ailment. And some I have been working with diligently in the private arena to bring attention to this very serious disease. We can do better for all Americans at risk for and affected by viral hepatitis. With scant federal resources, lack of program coordination, and the absence of political will, Americans have continued to develop liver cancer and associated lethal complications of viral hepatitis because of our inaction with regards to these preventable infections. There have been some positive steps, however. Representative Mike Honda has introduced legislation, which I support, to authorize a comprehensive prevention, education, research, and medical management referral program to reduce the disease burden associated with these costly and lethal infections. This bill, the Viral Hepatitis and Liver Cancer Control and Prevention Act, H.R. 3974, is also supported by Chairman Towns, and I want to thank the chairman for his support for this important bill. In addition to these efforts, we need to increase funding for viral hepatitis prevention. Despite dealing with an epidemic that the CDC estimates afflicts 5 million people, the Division of Viral Hepatitis is the smallest funded infectious disease division under the National Center for HIV, Viral Hepatitis, STD, and TB prevention. At 19.3 million, viral hepatitis receives only 2% of the center's total annual budget. Funding must be increased to the Division of Viral Hepatitis so that the division can mount an effective prevention response and begin funding preventative services. We must ensure that other funding streams support this work, especially as health reform authorizes new monies for prevention. I'm excited about the prospects of Dr. Howard Koh's interagency working group on hepatitis and the development of an HHS national plan on hepatitis. I hope that this work group will receive adequate resources and that through this work group, real and effective work can be done to forge a national strategy to combat hepatitis. Thank you for holding this very important hearing today and for allowing me to address this committee. I look forward to a very productive and robust hearing on investigating the federal response to viral hepatitis, and I'll yield the balance of my time.
Right. Then I'd like to thank the gentleman from Georgia for his statement, and of course, I now would yield time to Representative Cassidy. You're on appropriations, aren't you?
I wish. But no.
Representative Cassidy.
Thank you, Chairman Towns and Ranking Member and other members of the Committee of Oversight for calling this hearing. You know, for the last 20 years, I've been a doctor. I'm a hepatologist. Hepatologist is a doctor who treats liver disease. And so it's kind of a confluence of my career to be here in a political life to discuss this. I still treat patients in a public hospital back home, and I can, from my personal experience, verify this affects a cross-section of people, from folks who are homeless to folks who are nuns, folks who are bankers and teachers, folks who are somewhere at a more humbler economic station. And yet, they all have a common need, and that's to be treated or comforted. Now, among my clinical activities, as you mentioned, Mr. Chairman, was founding the Greater Baton Rouge Community Hepatitis B Vaccination Program. Over 6 years, we vaccinated 36,000 kids to prevent hepatitis B over a 10-parish area. Now, what caused me to do that program, there's an 18-year-old who came to the intensive care unit. They called me middle of the night. She was dying from hepatitis B. In the middle of the night, we helicoptered her out to a transplant center in Shreveport, Louisiana, and there to receive a transplant that would cost $200,000 to $400,000, and if successful, it would cost $30,000 every year thereafter to care for her with the medication and treatment. And I thought to myself, we're going to spend $1 million over the course of her lifetime when a $50 vaccine would have prevented this. For the amount that we're going to spend for this young lady, I could have vaccinated everybody in my community. So that's what we attempted to do. Now, let's give credit where credit is due. The way we were able to do that in this public-private partnership is that President Clinton proposed the Vaccines for Children's program, and Congress, in its wisdom, funded it. And so thereby, the biggest cost item, if you will, which was vaccine, we were able to get from the federal government, and then through our public-private partnership, vaccinate 36,000 children. Now, I'm a teacher, so let me pause for a second. I assume everybody has my knowledge, but I've been studying this for 20 years. Hepatitis, hep, is the Greek word for liver. Itis is for inflammation. And so and viral hepatitis is just inflammation of the liver caused by a virus. Hepatitis B and C being those causing chronic hepatitis most commonly. And folks ask the difference between hepatitis B and C. I say it's like the difference between a dog and a cat. They look alike. Superficially, they're the same, but in reality, they're two different animals. Hepatitis B are two different animals, so to speak. And they have different ways of being transmitted. Hepatitis B, I like to say to my students so they remember, is spread by blood, birth, and body fluids. So it's spread when a mama gives birth to her baby. If the mama's infected, the virus passes as the child goes through the birth canal. The child is infected from the mama's body fluids. It can also be spread sexually, spouse to a spouse, if you will, and also by blood. So B, and B. Hepatitis C is spread by blood primarily. There's a medical word for blood cells called corpuscle, so if you're one of my students, I would say C stands for corpuscle. You can remember it's spread by blood. Now, in the case of B, commonly it is spread mother to baby. But also it can be spread from the ages 15 on, because that's when kids become, or adults become sexually active and marry, but it's also when they engage in other high-risk activities. For the hepatitis C, it's typically spread when someone gets, in times past, a blood transfusion. So a mama gives birth to a baby, a Vietnam soldier gets shot and gets transfused, they get infected, and it doesn't necessarily cause a problem right away. What hepatitis does, the itis, the inflammation, is almost like a pimple inside the liver. A little pimple. It goes away. But if you have lots of little pimples, you have little tiny bits of scar tissue that build up. Now, over a course of a year, that's not going to be enough. But over the course of 15 to 30 years, those little pimples all over the place in the liver, which go away but leave a little bit of scar tissue, cause so much scar tissue that the liver no longer functions. We've all seen somebody, I like to point out, I have a scar on my wrist. That scar, my wrist does everything I want. I wish I could slam dunk a basketball, but it does, if I wanted to, it can do that. But we've all seen someone whose arm has been burned, covered with scars, so their arm doesn't work like ours does. It works more like a club. It loses function. Similarly, as the liver is progressively scarred, a little bit of scar doesn't make a difference. Progressive scarring inhibits the liver's ability, just like it does an arm, to function as it should. Now, I go through that to first say that, as Representative Johnson said, most people who have hepatitis C look like us. Men who are in their 50s, maybe early 60s. Now,
Committee will come to order. Today's hearing, entitled Viral Hepatitis, the Secret Epidemic, will examine the concerns about hepatitis B and hepatitis C as raised by the Institute of Medicine in a recently released report. That report, entitled Hepatitis and Liver Cancer, a National Strategy for Prevention and Control of Hepatitis B and C, indicates that the United States is experiencing a hepatitis crisis. Many call hepatitis the silent epidemic because the attention it received has not been in proportion to the vast number of Americans it affects. Hepatitis B and C are among the leading causes of preventable deaths worldwide.
I really want to vote against this. I think we should have kind of a strategy session with you and the ledge staff. Yeah. Because right now I think they probably have me as a yes, and I really would like to go to a no, but we need to understand the amendment completely as well. So if you would get on that, okay? And we're in session tomorrow with the Disclose Act. Call time for what?